A new study giving some breast cancer patients hope. The study, published in the New England Journal of Medicine, focuses on a new drug that targets cancer cells, slowing tumor growth and potentially extending a cancer patient's life. For more on this potentially game-changing treatment, I am joined right now by Dr. Elizabeth Komen, medical oncologist at Memorial Sloan Kettering Cancer Center. Good morning, and thank you so much for being with us. I want to make sure that viewers don't tune out. Obviously, a lot of us have family members or we ourselves have dealt with a cancer diagnosis. So just so viewers can wrap their brains around this more readily, metastatic cancer is when cancer moves from one part of the body to the rest of the body, essentially taking a person over. What would this new drug do?
So metastatic disease are breast cancer cells that have spread to another side of the body, like the liver or the bone, or sometimes even the brain. And this was really a groundbreaking study led by my colleague, Dr. Shinu Modi at Memorial Sloan Kettering Cancer Center, that changes the treatment and potentially outcomes for about 50% of breast cancer patients living with metastatic disease, and in particular, a type of metastatic disease called HER2-low metastatic breast cancer. And we're all just so excited about the new hope and promise of this medication for a large population of breast cancer patients.
So there are different types of cell receptors. You said HER2-low. Yeah. I want to make sure that it's not, again, a lot of jargon for people listening at home. But if a woman gets tested for this particular treatment, there have to be certain indicators that she would have her life extended. Is that right?
Right. So 2-minute biology, or even 2-second biology lesson, is that on the outside of our cancer cells, we have something called the HER2 receptor. Some breast cancer patients have it and some don't. Historically, we classified breast cancer patients as either HER2 positive, so they have a lot of it, or HER2 negative. And what we've since learned is that some of these breast cancer patients that we thought were HER2 negative were actually HER2 low. So they had a little bit of this HER2 receptor, which means that in this trial that they actually responded to targeted medications, a specific medication called TDXD or Enhertu that targets the HER2 receptor, goes into the cancer cell and kills it. And in turn, as we see, improves outcomes for breast cancer patients, helping them live longer and hopefully better.
I have had a family friend, pass away from breast cancer. He happened to be a man. Is this drug effective in men as well? Have there been any clinical trials for men?
So we need to look more into male populations. You bring up such a good point, is that predominantly women are affected by this disease, but there are several thousand men each year that are diagnosed with breast cancer. And as you said, there are men that die from it as well every year in this country. So we certainly need to look more into this treatment for men. But if there is a man diagnosed with metastatic disease, we can certainly determine whether he has HER2-low metastatic breast cancer. And certainly this may be a viable option for him.
Is this drug going to be covered by insurance?
Excellent question. So we need to push the FDA and insurance companies to make sure that this groundbreaking treatment is offered to patients, not just at academic centers, but across the country and community practices as well. So it's so important that patients have their pathology report, asked to know, am I HER2 low? Might this be a drug that I could be eligible to receive? Or do I need another biopsy to determine the nature of my breast cancer and if I might be eligible for the medication?
All right. Thank you so much, Dr. Komen, for being with us. We certainly appreciate this groundbreaking information. A lot of families should be encouraged this morning. Thank you
so much for having me and for your enthusiasm.
Absolutely. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.